Alright guys, let's get busy talking about the pharyngeal apparatus, and this is going to be an important developmental structure that turns into many things throughout development, and so it's important to memorize all of these structures and what they turn into and memorize them well. So this is going to be a lot of heavy rote memorization, so let's go ahead and get into it. If we look here at our diagram, we're going to see I'm making this red line through our embryo or fetus, and what this is going to do, it's going to create a cross section for us to identify this apparatus. So the apparatus is made up of a series of arches all in a row, and these arches themselves are going to go on to define clefts and pouches. So our clefts are going to be ectoderm derived, and they are going to be out here on the outside, whereas our pouches are going to be endoderm derived, and they're going to be located more interiorly. And then the arches are kind of like that meaty material that kind of runs through the middle of the clefts and the pouches. Before we get started talking about each of the individual structures, I want you guys to have a mnemonic, and this is called Medical Students Party in Vegas. And what happens here is I'm kind of highlighting this 1, the M, and the ear, and then I'm going to be highlighting the 2 and the S, and this is going to help us with our first set of structures, and it's going to continue out throughout the video, so pay attention, it will make sense in a minute. So starting with our pharyngeal clefts and grooves, these are going to be located in the ectoderm type tissue. So I'm highlighting in blue out here on the outside of our pharyngeal apparatus. You can see I'm also doing it here on this zoomed in version, and this is because this is all going to be ectoderm derived. So ectoderm derived is going to be important, and then our first cleft is going to create the external auditory meatus, and this is where our mnemonic comes in. So when it comes to things that are related to 1, so like number 1, the first pharyngeal cleft is going to be related to the letter M, so M1, and also everything in the first category also is related to the ear. So I want you guys to continue keeping this in your mind as we organize our clefts moving forward. So next we have our second cleft, which is going to turn into the cervical sinus, and this cervical sinus is normally going to obliterate. However, we can have some pathology when this obliteration fails, and if it persists, we're going to get something called a branchial cleft sinus, and this is going to be important in terms of differential making because branchial cleft sinuses are located laterally. So you're going to see it if we have this picture of someone's neck. We're going to expect to see them over here, and they're going to be fixed objects. They're not going to move, and this is as opposed to a thyroglossal duct cyst, which I'm going to denote with this X. These are found medially, and they also exhibit movement with swallowing. So I'm going to put plus movement when we're talking about our thyroglossal duct cyst. So this is an important differential to know, and it's important to know that the branchial cleft sinuses are going to come from our second pharyngeal cleft when it fails to regress. And to continue with our mnemonic, when we're in our second cleft, this is looking at things with S, so the sinus. So here you'll notice that we have S, 2, and S, and this is to help you remember that everything in the second region is going to normally have names that begin with S. Let's move on to talk about our pharyngeal pouches. So our pharyngeal pouches are going to be endoderm derived, which is why I'm using this gold color. If we go over to our diagram, we'll see on this interior portion of the pharyngeal apparatus, we are going to have endoderm derived pharyngeal pouches. So I'm highlighting everything in gold here so you guys can appreciate that. Let's go backwards to our mnemonic now. So we are in the first pouch, so we are in this M1M ear category, and you'll see that is the middle ear cells, M here, that are derived from this pouch, as well as the M for mastoid cells, as well as the eustachian tube, which is an ear structure. So you'll see that this first pouch is heavy in the M's and also in the ears. Our second pouch is going to create the epithelium of our palatine tonsils. This is a little bit lower yield, but it's still something that you should memorize, but the real heavy hitting points are going to come in our next two pouches, which are going to be the third and the fourth. So starting with the third pouch, we're going to get our inferior parathyroid glands, and this is going to be the dorsal wing, and then as well as the thymus, which is going to be the ventral wing of the pouch. And this is really high yield to memorize, and this goes into part of our mnemonic. So when it comes to the P, it looks like parathyroid, right? We have the party in Vegas, so the PAR reminds me of parathyroid as well as thymus for the T, and I like to remember that this is the third pouch. So that's how I remember this one. Our next pouch is our fourth pouch, which is going to turn into our superior parathyroids, which come from the dorsal wing of the pouch. And the superior parathyroids I remember as being our fourth pouch because 4 is 1 more than 3 and superior is 1 more than inferior. And this is also where we're going to get our parafollicular cells of the thyroid, and these are going to come from the ventral wing. Now, I mentioned earlier that the third and fourth pouches are particularly high yield, and this is especially with respect to DiGeorge syndrome, which is due to 22q11 chromosome deletion, and I want to highlight that here, and this sets us up for our mnemonic called Catch-22, which is a way to remember the presenting features of DiGeorge syndrome. So it's going to be cardiac defects, abnormal facies, and when I talk about abnormal facies, it's usually going to be like a small jaw or a cleft palate, something strange about their facial features. We're also going to see thymic aplasia, so this could show up as a absence of a thymic shadow on a chest x-ray. We can also have cleft palate, this goes along with abnormal facies, and then we can also have hypocalcemia because we have abnormal maturation or migration of our parathyroid glands, and we know that these are important in calcium homeostasis. Let's move on now to talk about our pharyngeal arches, which I'm going to highlight in pink because they are a mesodermal structure. And so if we look here in our overarching diagram, these arches are going to be this middle portion here that spans across, and I'm going to highlight one of them over here as well for you guys. And when we're talking about the pharyngeal arches, like I said, they're going to be mesoderm derived, as well as a portion of them that are coming from neural crest cells. So let's go ahead and get into the structures themselves. So in terms of our first arch, we're going to go back to our mnemonic. So this is all about M in the ear, right? So we're going to have the mandibular with M and the maxillary process with M, as well as the muscles of mastication, as well as cranial nerve V3, which is the trigeminal nerve, so with an M. And then we're also going to have the anterior 2/3 of the tongue. So going back to our mnemonic, we have M for things related to 1 and things that are close to the ear. So one other thing that I want to note is that we also get the malleus with M, as well as the incus from this area, and those are going to be M related as well as related to the ear. Moving on to our second arch, we are going to have the stapedius and the stylohyoid process. Going back to our mnemonic, this is going to be things related to the second portion as well as S. So we see that both those structures begin with S, and then we're going to have the facial muscles, which are responsible for smiling, which also starts with S, and then we're going to have cranial nerve 7, which starts with S, as well as the stapes and the lesser horn of the hyoid bone. So those are all related to S and the group 2 in our mnemonic. Moving on to our third arch, we are going to have the stylopharyngeus muscle, and I like to remember this PH part of pharyngeus is going to relate to the P in our party, and this is going to be group 3, and then we have cranial nerve 9, and if you draw out a a 9 and you were to reverse it, it kind of looks like a P. So I remember the P and the 9 for cranial nerve 9 look very similar, and then we also have the greater horn of the hyoid bone. Now that we've gotten a little further down our apparatus, it's time to add in our 4 and our 6. So you will see that 4 and 6 correspond to the vagus part of our mnemonic, and let's go over some of those structures. So when it comes to our fourth arch, this is going to create the pharyngeal constrictors as well as this superior laryngeal nerve. And you'll remember that the superior laryngeal nerve is a portion of our vagus nerve, which is why it belongs to that 4/6 category of vagus. Now let's move on to our sixth arch, and this is going to go on to form the larynx muscles, and I like to remember that larynx is 6 letters in length when you spell it out, so that helps me remember this. The exception here being the cricothyroid, and remember, step 1 loves to ask about exceptions, so it's important to memorize that this is not included because they love to ask about this. Also, we're going to have our recurrent laryngeal nerve, which is a little further inferior than our superior portion of the vagus nerve that was in pouch 4. Now you may be asking, what happened to arch number 5? And that's a fantastic question. And arch number 5 actually just disappears during development. So it's something that we don't have to worry about. It makes our life kind of strange because we get to skip over 5, but it's normal for this structure to regress. We just have arches 4 and 6. I want to wrap up our discussion discussion by talking about some disorders like Pierre-Robin sequence and Treacher-Collins syndrome, and these are going to happen when we have errors in our first and second arches. And what this does is it's going to create some errors along this axis of the face here, because that's what those arches turn into. So we can see things like a small jaw, which is called micrognathia, which we can see in this patient here, and we can also have some errors along the bridge of the nose and here in the cheekbones, and it creates this classic face of someone who has errors along their first and second arch, and you're going to expect to see these in these two disease processes. Let's wrap up our discussion by talking about the aortic arches now. So the aortic arches I'm going to put in this dark red color because they tend to be related to vasculature. So our first aortic arch going along with our mnemonic is going to be the letter M for maxillary artery. So I'm going to highlight up in red again here next to our mnemonic. Our second arch is going to make our stapedius artery, which starts with S, so that goes along with our mnemonic up here for S. And then on our third arch, it's going to be the common carotid artery, which starts with C and C. And I like to think of C as the third letter of the alphabet, so that helps me remember this one. And then also it's going to be the internal carotid as well. If we move on to our fourth arch, we're going to get the true aortic arch as well as the right subclavian. And then when it comes to our sixth arch, we're going to get the DA as well as the pulmonary arteries. And I like to remember that the 4 is more related to the heart, and then 6 is more related to the lung. And it's going to be the vagus nerve that serves both of these areas, and so that goes along with our mnemonic here, that it's 4 and 6 related to vagus. So that's a way for you guys to keep this one straight as well. I also have all this summarized in a table that you guys can take a look at in the PDF associated with this lesson.